Okay, great. Alja, thank you so much for joining us today. And you're going to share with us a little bit about, if that's okay, how you might be using EFT or tapping at work. So do you want to just let us know what you do, what your background is?
Okay, so I'm a social worker and I'm a hospital social worker. So I work in a clinical setting of acute wards of the hospital. I mostly cover intensive care unit, maternity, pediatrics, also surgical, emergency room, people at times, some outpatient clinics at times. So yeah, I get to see people that have some kind of health-related problem that they come with, or they might have a baby, or so on.
Oh wow, it's really varied. So how did you...
Some trauma as well, you know, after car accidents, you know, can be very, certain presentations can be very traumatic.
Absolutely. So how was
I can't see you.
How was it that you introduced tapping or EFT?
Okay, so I use it in combination with my other work. I usually just do very thorough assessment of what's happening, except if someone's extremely distressed, then I would perhaps introduce tapping straight away, and I would just use it as, I usually ask whether the person has heard about acupuncture before, and they usually say, yeah, I have. And I say, well, it's like a psychological acupuncture, just that we don't use needles. And people tend to relax once you say that, I just explain, you know, you use two-finger tapping and you tap on certain points to work on any kind of negative emotion or distress related to what they're going through. So
wow, fantastic. And how have your workplace, I guess your employers, how have they been being receptive to this kind of technique?
Yeah, so my managers have been very supportive and encouraging, and they encouraged me to attend training with you and bring some more knowledge here and skills and upskill myself. So, you know, and they continue talking to me about how we can introduce it more to other staff. And also, at the moment, I'm writing a little proposal on trying to get this approved to support our staff, social work staff who work in a very demanding roles, to use it as a group stress reduction technique for just to manage their stress level and all that. So so they're very receptive.
That's been
my
fantastic.
managers.
So if there was anyone out there listening, I guess, that might be in a hospital setting or similar social work background, is there any kind of tips that you would suggest for them to be able to take this into their own workplaces?
Yeah, well, I can guarantee that people, if you introduce it in a very succinct way, and specific way, and that works best. So in the most simple ways that you can explain how amazing and gentle this technique is to deal with real difficult emotion, people are often very open to use it.
Yeah, fantastic. I think
so,
simple seems to be the key, doesn't it? Don't complicate it too much, or the results speak. Yeah, great. Thank you so much.
I think down the track, if you need to explain a little bit about, you know, the nervous system and amygdala and so on, but I think at first the most simple way to use it, the better.
Great. Thank you, Alja, for sharing that. We'll see you soon.
Okay, bye.